I think my key success, I suppose, is my belief, is my convictions, because I would like to do, I would like to be a good Muslim. That is that's what I've been taught right from the beginning during my childhood. That we have to do good, we have to do charity in this life, and then I start slowly to understand how best that I can do this. I enjoy what I'm doing. I have this passions in my heart about the profession to become a doctor, but at the same time I'll be rewarded. So because of this, I think that has carried on this kind of convictions in my life. So this kind of belief keep me strong and also keep me going in order to be where I am, I suppose, right now, I think. So I would like the students have some set or some form of the public health knowledge or public health approach, especially during their right from their medical student itself. Because as you can see now that during the medical student days, we are very much exposed to the hospital, not so much the community, the public health, so on and so forth. But I start to realize that, especially now, that the way on how that we can tackle or we can handle the public health holistically is through the public health approach. Of course, there's a role of the clinicians, the specialists, the hospital, but there are more on the what we call the therapeutic or the sick care. But what is more important is to look at the public health approach in terms of the handling many of the problems or issues that we have right now. So I wish that element, particularly during the medical students' days or in the curriculum, we should try to put in, or we try to portion a bit more the elements of the community medicine, the health prevention, the public health approach. From my experience, maybe I can share with you that I first started as a clinician, and then all my career life is actually at the hospitals. Then I start to realize that I'm actually looking at a very narrow scope of a patients, or the what we call the spectrums of the problems in the healthcare. As a gastroenterologist and also as a physician, I'm more on the therapeutic area of the medical, and particularly in the gastro and hepatology. So it's very narrow. And I start to see that, for example, like I'm seeing lots of colorectal cancer. They're coming at the very late stage. Liver cancer coming at the late stage as well. And some of the problems that we have, for example, that liver cirrhosis, they're all coming at the stage whereby it's already developed the late stage of the cirrhosis, portal hypertension, so on and so forth. In order for us, I mean, we can produce as many as gastroenterologists, hepatologists to tackle this problem, but it will never be enough unless if you do another way around. I look at more on the preventions, look at what's the root of the problems, have promotions in the society or in the community itself. So these are all the public health approach. So I start to realize this thing. I think probably a bit later of my career, but I said never too late. So that's why I think I'm starting to get involved with my counterpart in the public health sector, in the klinik kesihatan, as well as the medical, in the health policy makers, how that we can work together. So I'm start seeing the result of it. So that actually brings me to this line, which I feel that I don't know, probably my predecessor Tan Sri Nur Hishams and also whoever at the top level management seeing me have this kind of approach. So I think that probably they have nominated and also perhaps suggested or nominate me as a Deputy DG because with this kind of what we call the scope that I'm seeing the healthcare at the moment, more holistically. Yeah. I think the most important thing, I think that this is very, very crucial. I'm glad that you asked these questions because this is very, very important. Number one, I think the main core value that I wish that everyone will have in order for them to be focused with their work, they must have the interest. This is the most important thing. They must be very passionate. It's not just interest. They must be passionate and they must believe in what they are going to be. If you have the passions, you have the interest, you work hard for it, and then you enjoy the work that you are doing, this is very fulfilling, especially when you look at the outcome of what you have done. So what drives me to this point is also because I would like to see, now I'm looking at the healthcare system as a whole. I would like it to change. I would like it to have some reform because we have so many issues, we have so many challenges. So this is where I think I would like to improve, and I would like to make it happen in a way that it should be. So that, inshallah, will be my fulfillment, something which I've rewarded. So no matter how much the obstacles or the problems that we're going to have, but with that kind of intention and convictions, I think, inshallah, I can overcome that. Okay. If we look at our healthcare system at the moment, I think we can see that perhaps it will not be sustainable to the extent. The first thing is that because of if you look at the burden of the disease, I mean, if we're talking about the NCDs, the cancer, the cardiovascular, the metabolic syndromes, the diabetes, they're all increasing. The geriatric problems, the aging populations, the age populations, they're coming with their disability. As they grow, they bring along their disability and their comorbidity. So this all will be the burdens to our healthcare system. I would like, especially our healthcare provider, including our doctors, to understand this, to look at the way how that we are handling our healthcare at the moment. There is so much focus that we have been put into the hospital, and then you all can see that as we can build as many hospitals as we can. We can build the dialysis center, we can build all the cancer institutes or so on and so forth, but they're all being filled up, congested. Okay, so now we have to shift. We have to shift our approach now. Instead of tackling or instead of focusing so much on the sick care or the hospital base, I think we have to move on more on how that we can do the prevention, the health promotions, awareness, so on and so forth. I think this is the way which I would like all our healthcare providers to understand this. So that including our medical students or even the doctors who are already on job training at the moment, to look at this so that we can be part of how that we can change this paradigm shift. So hopefully in the long run, we have lesser number of people getting sick, more people getting healthy. As they grow older, they grow in a healthy manner. So if we don't change to adopt or to adapt to that kind of all the new challenges that we have now, so we will not be able to cope. So we have to make some changes. Okay. And you can name it, the challenges in the healthcare. I think there are so many, and almost in everything that you touch, there will be something, a problem there. So we need to make a change. But something which is memorable, but probably on the sad side, which I'm saying in Kelantan, was that the patients who reach to us, they are all late stage, I think. they are very ill. If you're talking about cancer, it's all the cancer or the late stage. The breast cancer is all the very late stage breast cancer. The colon cancer is all the obstructed and all the, which is emergency. The infection, the septicemia is all the very bad septicemia. So this is something which is, well, it's something I always remember. That's also one of the reasons why I feel that I need to do more. One of the reasons, for example, like colorectal cancers, we are saying so common. They're all coming at the late stage. Something needs to be done. So that's why I also venture into the colorectal cancer screening. Yeah, they believe so much into alternative, the BOMO. So this is something which is I learned a lot. Even though there are other cases, but I think it's quite deep rooted in Kelantan at that time. Lumbar puncture is almost no. It's really a huge taboo in Kelantan. Yeah, so this is something which is a learning to me, which also an insight for me, which I think that I have to look at this problem from the broader perspective, I think. The second thing is that, of course, I think the food is nice. I enjoy the food very much over there. This is something which I always, until now, I like nasi kerabu, I like all those, the Kelantan food. And of course, I think that the last and probably the most memorable one is, of course, the lecturer in Kelantan. I think they are very unique because I have the opportunity and the privilege to be taught and to be trained by the senior and experienced physicians. The endocrine teams are superb over there. So I have the privilege to have them at the height of their career. So I get the most of their wisdom, apart from the training in medicine, so on and so forth. So I have them. I have that kind of their wisdom which they share with us. So this is also another one. So you said 3, is it?
Yeah.
So yeah, so these are the 3 things, yeah, which I think my memorable experience in Kubang Krian.